Good morning. I'm hoping that you can see the screen now and we've shared. Brilliant, lovely. Good morning. So yeah, my name's Carolyn Taylor and I've got my colleague here today, Deb Griffin. We're Stop Smoking Champions for Wiltshire Council and Health Improvement Coaches. There's 3 Stop Smoking Champions within the Health Improvement team. A champion has just been, we've just been trained a little bit higher than the health improvement coaches. So we sit under some of the specialists and liaise with them on any stop smoking updates and feed that back down to the health improvement coaches. So today we're going to talk about the service, but particularly probably the stop smoking. So let me see if I can move forward. Lovely.
Brilliant. So yeah, good morning everybody. So I'm Deb Griffin, as Kaz mentioned, and I cover really sort of the north part of the county. So just wanted to give you a little bit of an insight as to what we do as health improvement coaches. So we do ideally work on a one-to-one basis. We have in the past worked with partners, for example, but ideally we would like to get that person on a one-to-one basis. And the main reason for that is really you might live together, you might have the same kind of idea about what being healthy might be, but your methods of motivation could be completely different, and what drives one person may be completely different from the next. So if you would like to stop smoking, then the health improvement coaches are the people that you need. Alternatively to that, we do also see people that want to change other health behaviours. So examples of that would be somebody that potentially wants to become more active, somebody that wants to lose weight, but also somebody that might want to eat better. They might find that due to their work commitments, they tend to not eat very healthily. If you find that you're potentially drinking more alcohol than you may have done, and we have seen that since COVID, unfortunately. So maybe you want to just rein your drinking in, but also in improving your emotional well-being. So if those are the types of behaviours that you're thinking, actually, I could do with some help, and you're not too sure what you can do about that, then the service that we offer probably is the right one to start with. It is a service that's available to anybody over the age of 18 years old. We can do appointments, but at the moment they are only over the phone or video call. As soon as the restrictions allow us to, we are absolutely itching to get back to the community where these sessions will be done face to face. In terms of new ways of working, I think a lot of people have had to work from home, and we have seen some benefits from that, where actually a phone call to somebody is more convenient for them. You know, they're in the comfort of their own home and they don't have to come out into the community. So I think moving forward, that will be something that we'll offer as well.
Okay, so the stop smoking service particularly, it's a 12-week support. The sessions are normally 30 minutes long. Maybe the first one might be an hour, just so that we can talk about prescriptions and any general health information. These sessions are spent, we talk about prescriptions, we talk about NRT, nicotine replacement therapy, and what's going to work best for the person, or what the person chooses and wants to use. We can also support people in vaping as well. We look at behaviour change. So we're very much a service. We're not going to just give you the prescription and you pop off on your own and take that NRT. We look at behaviour. So we will look at how many cigarettes you're smoking a day, what time of the day are you smoking. We look at things like distraction techniques, how we can distract you from going for that cigarette once you've set that quit date. We also look at things like plans for setbacks. So if we do have a blip, that, what plans can we put in place? It's a tailored service to each client, because clients can smoke less or more. They can smoke roll-ups or tailor-made, or even pipes. I've had a pipe gentleman recently. So we look at the individual. It's very person-centered around that client. Once we've done the 12-week support, we look at maintenance checks. So after the 12 weeks, we'll check in with somebody at 6 weeks. Then we look at 3 months, 6 months, and probably check in with them a year later as well, just to make sure that they are still in a quit mode. Fabulous.
So linking on to that behaviour change, the the majority of our conversations are around the behaviour change and how you can manage those distractions and curb those cravings, because we do know that giving up smoking isn't an easy task, and it is hard, and things will happen where it makes you think, oh, I really, really fancy a cigarette. So it's really important to keep these conversations active and keep having them every single time that we see that person. So sometimes just a bit of tough love is what that person needs. So for example, if they really are really craving a cigarette, we might say, right, delay that for 5 minutes, because we know that cravings will last for a good 5 minutes. After that, it will get easier. So let's have a conversation around what you can do within that 5 minutes. So can you just say, I'm not going to do this, I'm not going to have a cigarette, I'm going to be cross with myself if I pick up a cigarette, I've come really far. Those types of positive conversations. Doing something else is really, really important, because what we find is that if you're sat down, you're craving a cigarette, you're not having the best day, that's going to be really, really challenging for you. So what we want to do is build somebody up to have lots of options available to them. Something that we recommend is actually something that somebody may have just in their home. We don't really recommend people go and buy things unless they really want to go and treat themselves. Something like an elastic band around your wrist, just twanging that elastic band hopefully will just manage those distractions well. Something like Play-Doh, if you have children at home, a lot of people have Play-Doh, so just build something out of Play-Doh. You can be amazed what fancy things you can come up with. Something like the adult colouring books. So I don't know if anybody's ever seen the adult colouring books, but they're really finely detailed pictures, and actually being lost in a colouring book will help pass that time, so that hopefully once you've come out of that colouring session, you haven't thought about a cigarette for the time at all. Other things that we might do actually will incorporate into the other health behaviours that we actually cover. So for example, going for a very small walk. If you want to go for a walk, it doesn't have to be a half an hour to an hour walk, just walking around the block, especially if it's not something that you're used to doing. Reading a book, picking up something new that potentially you've not done before, so forming a new healthy habit. Maybe phone somebody, so connect with somebody that you potentially haven't spoken to for a while. Do a job that maybe you've been putting off, and actually it's something that's been bearing on your mind. So you think, actually, if I get this job done, it will manage those cravings, it will distract me, and I'll have achieved something at the end of the day that maybe I wouldn't have done before. Drinking something is important. So again, it's just something like, do you normally have a cup of tea with a cigarette in the morning? Okay, so how can we mirror that behaviour but make it more healthy? So still have your cup of tea, but have something else in your hand instead of. So it could be your phone, send somebody a text message. It could be just a pencil or a pen, just so you've got something in your hand to help manage those. Sometimes a lot of people will have just a glass of water and pop it in the fridge so that it's a colder glass of water, and sometimes that's a really nice taste. Or pop in something like a slice of lemon or something, just so it changes those tastes around. We also talk about breathing, because actually it is really important that somebody who is giving up smoking manages some of the things that they associate with smoking better. So we do find a lot of people will smoke because they feel stressed. And if we move on to the next slide, just talking about some mini relaxation exercises. So actually what we can't do is promise that those stresses won't go away for you. We'd love to, absolutely would love to fix whatever in your life stresses you out. But what we need to do is actually encourage somebody and teach somebody how to manage their stress levels in a slightly better way. So for example, going for a walk around the block, taking yourself away from the situation that is stressing you out could be all they need. But actually sitting down and doing some just quick breathing exercises, we can talk through somebody with how to do that, because a lot of people isn't something that people would be used to doing. Alternatively, there's podcasts and YouTube clips and things like that that we can direct somebody to. Okay.
Lovely. So I'm going to talk about here a little bit about money saving. It's quite an interesting slide. So I'm going to pick on the 20 cigarettes per day. So you can see here, we try and encourage people to save this money as well. So get a jar and put the money in each day or each week. Or if some people have got bank accounts, that they'll put it and move money across and start saving. So I'm just going to pick here that there's 20 cigarettes a day is roughly about £9.24 at the moment. So the cost per week, you can see here, is £64.68. And then after a year, 3,363 over 5 years, over 10 years, and over 20 years. So you can see that actually there's quite a lot of money that could be saved here. There are people that obviously smoke that struggle and that don't have money or are on benefits. So this is a really good slide to work with them. But yeah, we try and get people to put this money away and see it building up and then use that as a reward or a treat. So maybe somebody after a week has got this £64 that we can sort of say, well, what would you like to do with that? You know, it's a motivator, it's an encouragement for them to save and put it away. So I've worked with a client before that actually has saved this amount of money and more and actually started to learn to drive, single mum. And that's what she put her money towards. So that's a real benefit, and it's something she never thought that she could actually pay for. So yeah, we do like this slide.
Yeah.
The next one is a bit about health benefits from quitting smoking. So obviously, you know, we breathe more easily from giving up smoking, and it gives us more energy. So again, if we're giving up, then you know we can do these lovely walks at a better pace or do some gym or activity and exercise, so we're breathing more easily. Smell and taste starts to come back, so things like when we're cooking things, we can smell it and taste it, or even just simply our partner's perfume, we can actually smell it. Better sex life, protecting your loved ones and pets. This is a good one, you know, because if we are smoking within the home environment, we're passive smoking, and this can affect our loved ones and children and babies and also pets as well. It's not good for those. We get better skin, better hair condition. We live longer, and also we get the whitened teeth and the sweeter breath. You know, there are more health benefits, but the live longer, I think, is the main one. If we look at that, that's a big category for things like the cancer and heart conditions and things like that, which you can put in there. But yeah, live longer. The next one is how to refer. So it is quite easy to refer. You do not have to have a GP's referral. It is self-refer. So we've got the link there, which takes you to the Public Health Improvement Coaches. There's also a phone number and selection option 1. There's emails there as well. So we do have a gentleman that sits on the emails and the phones, and he'll have a good chat with people and look at what ways to refer, which route you want to go. So there is the Health Improvement Coach. We do have a weight management program, which is a group of people that do it on teams. So it's like 10 to 12 people and it's group work. We also have the Healthy Us as well and the children's Healthy Me. There's also a Facebook page, so if anybody'd like to join that or link to that as well, that would be really good, and share. And then we also have useful websites. So I'm hoping that Liv might share this PowerPoint with you here today, but obviously there's the NHS conditions, stop smoking treatment. There's the NHS Better Health Quit Smoking. Today is the day. It's just got lots of information on again, and also smoke free. So the smoke free, that's really good. There's an app for that as well, so you can actually, if people want to quit smoking, we do recommend that they have the smoke free app, and it will ask things like how many do they smoke a day, their date of birth, what sort of money they're spending a day, and it will give you helpful hints and tips and encouragement through the days, and like link or text you, or you know, give you special little things to keep upon each day, and you can see that build up the days, you know, that you've not been smoking. And then the last one is any questions. So open floor now.